Hello friends, let's do some real quick endocrine disorders. Yay! Since your other video was really long. I try and keep them at 10 minutes, but I didn't notice that it had gotten to 20. Sorry, so that was like two videos in one. Okay, so there are two types of endocrine disorders. Typically, they are hyposecretion, which means hypo means less. There's an inadequate hormone release, like there's not enough of the whatever we're looking for of the hormone released. Okay, there's not enough of it. This is usually a tumor or lesion, destroys glands, or interferes with the ability of the cell to receive the signal. So either the gland is not making it and releasing it, or the receptor is not picking up, right? So either it's a receptor problem or it's a gland or hypothalamus problem. Autoantibodies or immune cells fail to distinguish the person's own gland from foreign matter, and sometimes they get destroyed. So hyposecretion, not enough of the hormone is released. Hypersecretion, too much, slow it down, we don't need that much. Excess hormone release. Tumors, autoimmune disorder, Graves' disease, gouters, iodine deficiency is the most common cause of goiters. So this is like, there is too much. Hold on. Okay, so here's our super fun lack of iodine, essential for thyroid hormone production, will develop a type of goiter lacking, usually when you lack iodine in your diet. So this is what they look like, just like a big, that is what a goiter looks like. Pituitary disorders, hyper, too much secretion of growth hormone. This is the thickening of the bone, softening of tissue. It typically, you will see it in giganticism, so people who are like very, very large. And you also have dwarfism, which is hyposecretion. One is too much, one is not enough. Rare, since growth hormone is now made by genetically engineering bacteria, so we can fix that if we know that it's a pituitary situation. So here, Andre the Giant was a professional wrestler measuring 7'4". Robert Wadlow, the Alton Giant, lived to age 22, and Bao Xing at age 73. And also dwarfism. Criteria for dwarfism is you have to have adult body height less than 4 feet. Okay, parathyroid gland. We talked about this in the first lecture, but this is just a reminder. This is your thyroid, and these are your parathyroid glands. Okay, they secrete parathyroid hormone. And that increases your blood calcium level, promotes the synthesis of really calcium. Calcium increases the blood level of calcium, increases the absorption of calcium, and increases bone reabsorption. So it's pretty important, your parathyroid glands. Now, parathyroidism versus regular hyperthyroidism. So parathyroid glands affect calcium, bone and joint pain, kidney stones, memory problem, and you can have minimally invasive surgery if you have hyperparathyroidism, meaning your parathyroid is producing too much. See how we broke that down? Hyper, too much, parathyroid, right? Okay, hyperthyroidism. This just means your thyroid gland is producing too much. It's producing what? Too much T3 and T4. This gives you a super high heartbeat, unexplained weight loss, heat intolerance, and tremors, typically medication or radioactive iodine. And again, here you have your thyroid, and sometimes when they go in to fix your thyroid or reduce your hyperthyroid, you will get a nick in this parathyroid gland or any kind of surgery near your thyroid. Sometimes something will happen to these, and that's how you could get hypoparathyroidism. Sorry. Okay, so parathyroid hormone is a hormone secreted by the parathyroid gland that plays a crucial role in regulating calcium and phosphorus. Hypoparathyroidism, not enough, because surgical excision during thyroid surgery or any kind of surgery. What happens? Fatal spasms in your larynx in just a few days due to the rapid decline in blood calcium level. Not good. Hyperparathyroidism. This is the excess secretion from your parathyroid Bones become soft and fragile and deformed, and calcium and phosphate levels increase, and they can promote renal calcii formation. You can also, another adrenal one is Cushing's syndrome. This is excess cortisol secretion, hyperglycemia, hypertension, and weakness, rapid muscle and bone loss due to protein catabolism, and abnormal fat deposition, like a moon face. I'll show you a picture. AGS is an adrenal and androgenic hypersecretion, which accompanies typically Cushing's, and enlargement of external sex organs in newborn girls, and like masculized genitalia. So this goes along with the masculizing effect of really tiny girls, and sometimes confusion about gender. So here is a cartoonish sort of picture of it. Is again a problem with the hypothalamus pituitary gland and gonad releasing hormone and other growth hormones, and that is just causing a change in the testes if it's a boy, a change in the ovary if it is a girl, the skin, there's going to be facial hair, there's going to be some other dysfunctions on that. Diabetes, most prevented metabolic disease in the world, metabolism disrupted due to hyposecretions or inaction of insulin. Insulin sensitivity, degree to which body responds to insulin versus insulin resistant. Cells are less responsive. So insulin sensitivity means how sensitive is your body. As you get older, you become more resistant to insulin, and you will get type 1 or type 2 diabetes, polyuria, excess urine output. You will get intense thirst and hunger. You will have elevated blood glucose, and you will have ketones in your urine. So again, pretty easily detected with a urine test. We don't need your blood to know if you have diabetes. Okay, thank you.